The term mommy makeover has kind of become a cultural thing. You don't have to explain things to patients. When you say mommy makeover, they understand, they get it, they know what they've been through, they know what it includes. It usually is breast, tummy, and parts of their body. When we use the term mommy makeover around here, it describes a collection of procedures that we do to help restore the changes that ladies get with childbearing, and usually with multiple childbearing. Do I see 70-year-olds in here who've had 5 kids, and you look at their bodies and you can't tell that they've ever had a child? We call those freaks of nature around here. It's much more common to see the lady that's in her mid-20s who's had maybe even just one, and you can still see that there's some changes with her tummy. So the way that you handle those childbearing changes is genetic. Some of it also is how much weight did you gain with your pregnancy, so that's always important to remember. But a lot of it you just can't change, because it is your genetic predisposition to handle changes in weight and stretching. The breast and tummy are probably the 2 most common areas that patients come in and want to talk about. With the tummy, our options range from lipoplasty to tummy tucking, and that will be determined on what the skin quality is, and patients can usually just tell me whether they're going to need something more done for their skin. Lipoplasty doesn't do anything really for your skin. We can take the fat out, and your skin is then called upon to shrink. If it's been expanded and shrunk to a greater or lesser degree enough times, it's just not going to shrink well enough for you. And in that case, we need to do a tummy tuck. Tummy tucks don't come in just all one size. Sometimes what we call like a little mini tummy tuck, where we leave the belly button alone. But most tummy tucks that are going to be maximally effective do involve making a little incision around the belly button and then taking that little curvilinear incision along the lower part of the abdomen to tighten fully the skin and take off excess fat, and at the same time look at the condition of your rectus muscles. These 2 vertical linear muscles that run up and down, they're parallel in the abdomen. With pregnancy, they're usually pushed apart. That's to accommodate the size of the uterus, and once the pregnancy is over, then that usually comes back. But each time that that's stretched and allowed to come back, it can then come to rest at a wider point. That's called diastasis. You can't do anything in exercise to make the diastasis go away. You can make your abdominal muscles have more tone and give you more core strength, but you can't pull those 2 edges back together. So that's what we do when we do a tummy tuck. We look at that. We don't cut the muscle. We don't go inside the abdomen. We just make a little internal corset, if you will, from the top to the bottom to bring that edge of the muscle back. So now when you tighten those muscles and work on that tone, it'll really flatten the tummy. So that's part of a true tummy tuck. So some of the most satisfying things that I get to experience is the aftermath after doing these things for this well-motivated group of patients for Mommy Makeover. The ones that have been very frustrated with the results of just diet and exercise alone, when they come back after we've done a tummy tuck or lipoplasty or a combination of those things, there's some excitement. There's some real excitement, and I get excited. And I made some comments to some patients, and they go, no, you just don't understand. We've done as a team here things that I could not achieve through diet and exercise, and I have felt the best about myself forever. And that's been very satisfying for us. So at Clinton Plastic Surgery, Mommy Makeovers are something we do all the time, and at the same time, it's never a cookie cutter approach. It's never a conveyor belt practice. We want to listen to your concerns. We want to tailor what we do to suit you. We want to use our experience, our training, our insight, to give you the best possible results. So if you're interested in something like that, we'd love to see you. Find us at clintonplasticsurgery.com or call us at 205-408-9787. We look forward to seeing you and revealing your beauty, not just creating it.